Joining us now in the studio is Dr. David Sandler and Lane Mackey. An ablation also fixed a wiring problem with his heart, and we'll get to that in just a sec. But first, let's finish up with SVT. When do we need to go to a doctor, and when do we need to press the fact that we're having a symptom?
I think when people have a heart that's racing out of proportion to what you'd think would be normal for that level of activity, you should certainly alert your doctor. Sometimes that can be normal. Some people can have a resting heart rate over 100, and that can be normal. But when you're sitting there and out of the blue, your heart races 150, 170 beats per minute, you can take your own pulse on your wrist, there's probably something wrong.
When you do go to the doctor and you've been told, no problems, it's anxiety, it's nothing to worry about, do you go for a second opinion, or do you just take it at face value?
I think the next thing I would do is I would say, I keep telling you I have a problem. You've never had an EKG on me when I've had my problem. If my EKG keeps being normal in the office, why don't you put a monitor on me? Let me prove it to you. Let me put a monitor on. They have monitors now that you can wear for 30 days. We even have monitors that you can implant under the skin in rare situations that you can keep in there for 5 years. Let me prove to you that my heart is actually doing something funny. I'll catch it. And then the proof is really in the pudding. You have the EKG when you're having the symptoms.
Are these types of surgeries common for people now? Is it becoming a more normal fix for the problem? Or do we have a lot of people who just do the squeeze like I used to do to try and make it stop?
Right. First of all, I do believe that if you can make every episode stop and they're infrequent, I think it is very reasonable to avoid having any type of procedure. The definition of a minor surgery is a procedure being done to somebody else. It is very reasonable to not have a procedure if you're having an episode, let's say, every 6 months or a year, that you can terminate by yourself without needing an ER visit. I think once you've needed an ER visit or you're taking medication for supraventricular tachycardia, it's important that you at least seek a consultation with an electrophysiologist to get a once and for all cure.
And that's the person that you are, the
Exactly.
electrophysiologist. Not a cardiologist who does the other end of it, which is the plumbing work,
Exactly
which is
right.
what I had been sent to before.
Exactly. Very commonly, people with arrhythmias, electrical disturbances, are seen by the plumbers and seen by the general cardiologist. And it's important that if you have an arrhythmia, you really seek consultation with someone who does this every day, all the time, just takes care of heart arrhythmias.
And we have more and more electrophysiologists all the time right here in Tulsa.
Exactly right. We'll be adding our third electrophysiologist next Monday. His name is Dr. Greg Koger. He'll be joining myself and Dr. Craig Cameron at Oklahoma Heart Institute.
Fabulous. Now this ablation that you used on me, which was a quick, simple 2-minute fix, can also be used for other arrhythmias, and that's why Lane Mackey is joining us. You actually found your own heart problem, which is a different problem than I had, called atrial fibrillation. And what is that?
Well, it is a lot the same as SVT, except it originates in the atria in the top part of the heart rather than in the ventricles.
What kind of symptoms were you having?
The symptoms I was having were, the lightheadedness, the palpitations, a little bit of shortness of breath, just really feeling weak.
And what did you attribute that to?
I thought a lot of it was probably anxiety-induced, stressed, but after, hooking myself up to a monitor, I realized that it was actually my heart instead of the stress.
Now, working in a hospital, you had an advantage some of us don't.
Right.
For those of us that don't have that advantage, what should those symptoms be telling us?
That's actually interesting. I keep a list of all of the different symptoms patients with atrial fibrillation report. Now, with your condition, supraventricular tachycardia, your heart rhythm was very regular and fast. If you could run to the beat of it, you could keep up. With atrial fibrillation, the rhythm is completely herky-jerky. People tell me that it feels like squirrels are wrestling in their chest. People tell me like that it feels like Morse code, dit, dot, 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 that their heart is beating to the beat of a drunken drummer, and all sorts of rhythms, explanations like that. The heart just doesn't have any rhythm to it. It's very chaotic. And that's really what distinguishes atrial fibrillation from SVT.
And with atrial fibrillation, you can go in and do the same type of procedure. Is it as quick and as easy?
No, it is not. So, over the last 10, 15 years, we've really conquered SVT I hope that most people know that once you've been diagnosed with SVT, it can be cured with a simple procedure. Now we're getting the word out with atrial fibrillation. Up until recently, atrial fibrillation was really going to be a lifelong sentence. There was no treatment for it except for antiarrhythmic medications. Occasionally we just gave up and we'd put a pacemaker in and ablate the middle of your heart and disconnect the top chamber from the bottom chamber, letting the top chamber stay in atrial fibrillation for the rest of your life. Now we have a treatment called catheter ablation for atrial fibrillation. Unlike SVT, it's not a simple 1 or 2 burn procedure. It probably can take us 3, maybe as long as 5 hours to electrically isolate the 4 veins that bring the blood back from the lungs into the heart for reasons that are still somewhat unknown. Those seem to be the triggers of atrial fibrillation in normal hearts in about 90% of patients.
When you do see a patient for this procedure, are they typically as young and as healthy as this guy here?
So atrial fibrillation is extremely common in the elderly. They say that 10% of people in their 80s have atrial fibrillation, and we see people all the time in their 60s and 70s with atrial fibrillation. Some of them are great candidates for the ablation. They are. The ideal candidate would be someone like Lane. I mean, I couldn't imagine putting him on antiarrhythmic drugs for the rest of his life. In his case, we had tried 2 different antiarrhythmic drugs, and neither of them was working, so the decision was easy. But you know, as someone his age, you just can't imagine leaving them on a drug for 50 or 60 years when we have a treatment that can be done within 1 day.
All righty, and if people have more questions, can they contact the Oklahoma Heart Institute?
Absolutely. The Oklahoma Heart Institute, we're online at oklahomaheart.com. You can also call us at 918-592-0999.
Well, thank you both for being here and sharing with us today. Appreciate it.
Thank you.